Malaysia merekodkan kes positif pertama varian yang dibimbangi VOC Omicron.
Deaths from coronavirus infections in the UK has topped 150,000.
We've just heard that more than half of the European population are expected to contract Omicron in the next 2 months.
China has identified the cause of the mysterious new virus,
coronavirus.
Countries around the world have now reported more than 1 million coronavirus cases.
coronavirus, kumpulan virus besar yang boleh menyebabkan demam, selsema.
Okay, so from the beginning of the year, we have been tracking this virus, and we know that it is gone through a lot of changes, and there have been variants before. Now, this particular time, there have been 2 particular variants that have been reported to WHO. One was identified in the UK and one was identified in the South Africa. They do have one change in common. We call it the N501Y mutation, but otherwise the two are different. And the reason there is concern is that both of these variants were associated with an increase in the number of cases in both of these countries. And scientists have now studied this and have found that these variants do tend to spread faster. They are more transmissible or more infectious. So that is the worrying part. However, so far, they do not seem to cause more severe illness or a higher death rate or any sort of different clinical manifestations. So they seem to behave pretty much as the previous virus were behaving and cause a pretty similar kind of disease.
This is a very important point that vaccine developers keep in mind. And as you know, we have some vaccines like measles, which you don't need to change at all. You make the vaccines, it works pretty much all the time. But you also have vaccines like against the influenza virus, where you have to change the structure of the vaccine every year based on the circulating strains, and WHO coordinates this global network that actually identifies which strain should be used every year. Now for SARS-CoV-2, we are still learning, we are still observing, and our knowledge is evolving, but at this point in time, most scientists believe that the vaccines they are currently in development and a couple that have been approved should provide protection against this variant and other variants, because these vaccines elicit a fairly broad immune response, a host of antibodies and cell-mediated immune responses. And so a couple of changes or mutations in the virus should not make these vaccines ineffective. But right now there are studies going on in labs around the world to actually confirm that, and in the small possibility that perhaps these are less effective against one or both of these variants. Nowadays, the way vaccines are developed, it will be possible actually to also change the composition of the antigens and the vaccines quite quickly.
So, what we know about this variant and also the previous variants is that the virus is still behaving in the same way. It's spreading in the same way. And the more we give it a chance to spread and to multiply within humans, the more chances it's going to have to keep changing itself. That is natural property. So, we really need to go and focus now and attack it and make sure that we are doing everything we can do to reduce transmission. And we know the things that work. We know that testing, that identifying those who are infectious, that being able to provide them supportive isolation, tracking and contact tracing, and quarantining all the contacts, making sure that people continue to comply with the physical distancing, with wearing a mask, with avoiding crowded places, avoiding closed settings where there are a lot of people, and don't forget washing hands, respiratory etiquette, staying home if you are sick. All of these things together definitely make a difference in bringing down transmission. That's been shown again and again and again in all of the country. So I think at this time we need to double down, because we know the same public health and social measures will work against these variants as have worked in the past. And right now we are at a very critical stage in many parts of the world where we really need to be focusing on bringing down the transmission, and that in turn will help in reducing how much the virus can actually change.
Ensuring the health and safety of our volunteers and members is our highest priorities. Acting swiftly to prevent the spread of COVID-19, such as washing your hand for 20 seconds, will not only reduce your risk of the coronavirus infection, but is an act of solidarity. Protecting yourself decreases the risk that you will infect people in your community and around the world. The Ministry of Health Malaysia defines close contact to a confirmed COVID-19 case as being in close presence of within 1 meter from a confirmed case for a duration of not over 15 minutes. Thus, the recommended social distancing for the public is to be apart from each other at a distance of not over 1 meter. In some countries like USA and UK, a social distancing of 2 meters is recommended instead. Public Health England (PHE) describes social distancing as steps taken to reduce social interaction between people to reduce the transmission of COVID-19. According to PHE, the objective of social distancing are more than maintaining the physical distance between persons, which are two. Number one, avoid contact with someone who is displaying symptoms of COVID-19, which include a high temperature and a continuous cough. Number two is avoid non-essential use of public transport when possible. Number three is work from home where and when possible. Number four is avoid large and small gathering in public spaces like restaurants, leisure centers, and enclosed space. Number 5 is avoid gathering with friends and family while keeping in touch using remote technology such as phone, internet, and social media. Use telephone or online service to contact your general practitioner or other essential service.